Good morning. A common assumption that many of us hold is that the major health challenges affecting people in the global south, countries marked by poverty and limited development, would be those of HIV/AIDS, malnutrition, high maternal death rates. However, with the advent of the Millennium Development Goals, which culminate this year, there have been significant reductions in these health challenges, which is very heartwarming. Nonetheless, while they do continue to wreak havoc, there is a new health concern that is now dominating the global landscape, and it is that of non-communicable diseases, of which diabetes is one. Today, 387 million people are living with diabetes throughout the world, and if nothing is done, that number is projected to rise by 53% by 2035. Think about it. 592 million people will be living with diabetes. The projected rise in North America, the Caribbean, and Europe will be 31% and 33% respectively. In the Western Pacific, 46%. In South and Central America, 55%. And in Africa, the projected rise will be 92%. Key to shifting our understanding is realizing that today, 3 out of 4 people living with diabetes now live in low and middle income countries. And the onset of the disease has shifted down a generation, increasingly impacting those in their most productive years of life. Moreover, 46% of those with diabetes don't even know they have it. And it is serious. 4 million people die from diabetes throughout the world today, and millions more suffer from long-term complications and disability arising from kidney failure, blindness, lower limb amputation, and cardiovascular disease. According to conventional medical dictates, diabetes is most effectively managed by individuals through diet, exercise, and medications as needed. However, despite what appears to be a very straightforward regime for behavioral modification, is clearly insufficient. The International Diabetes Federation argues that diabetes is a social disease that is largely generated by the way we live, work, consume, and do business. They would argue that in addition to the genetic predisposition of some is poverty and attendant food insecurity, unmitigated stress, globalization and the opening of national markets to highly processed, low nutrient and cheap foods, high in sugar, fat, and salt, low health literacy levels, limited access to quality health care, and growing urbanization as people desperately seek a way to survive that is leading to overcrowding and a reduction in green space, which further reduces opportunities for physical activity. These are the social factors that underpin the personal risk factors for diabetes. The IDF and the World Health Organization argue that diabetes is a global societal catastrophe that is and will impact human security and human development. They insist that people living with diabetes must play a central role in generating diabetes and related policies and determining the health services that will best enable them to manage this disease. As a nursing educator, my aim in the 21st century is to cultivate critically reflective practitioners who support global health and human rights by focusing on political, social, and economic forces. Alongside my colleagues, I work with students to foster a global worldview and to deepen their appreciation of locating their practice in the promotion of health, rather than exclusively in the dominant biomedical model that is oriented to treating and curing disease. This is critical, especially now in these days. Since 2006, we've offered an international practice experience to Guatemala that focuses on community health. We go as invited guests, and we work closely with local grassroots Guatemalan organizations that are promoting health at the local level by building capacity and by addressing those fundamental social issues that I just mentioned. For really, it's not a question of either a biomedical model or a health promotion model, but rather it's broadening our vision, our understanding, and our actions to address those critical social forces. When we first went to Guatemala, we too focused on the critical issues of sexual health and communicable disease prevention. However, the signs of the diabetes epidemic were already evident in 2007 when Maria Teresa, one of our practice partners, a Mayan indigenous leader who had type 2 diabetes, urged us to address it, arguing that it was just below the surface and all the critical pressures were in place for it to explode. We offered some isolated diabetes education, but we really didn't take her seriously. Sadly, Maria Teresa died 2 years later of complications from type 2 diabetes at the age of 57. And still, we thought diabetes was isolated to a select few. That all changed in 2013 when we discovered that many of the people in one of the villages in which we were working had developed diabetes in what appeared to be overnight. They didn't know why, who was next, how to protect their children, and they were scared. Research is central to generating new knowledge and ways of practice that are going to enable us to address the formidable health challenges of diabetes. And so, in the spring of 2014, we collaborated with the Cooperative of Nuevo Horizonte to carry out a diabetes research project, examining the prevalence of diabetes in the village and also best ways to prevent and manage it. However, this research project was different in two key areas. Firstly, undergraduate nursing students were involved in creating, carrying out, and evaluating the significance of the findings. And secondly, the Cooperative of Nuevo Horizonte was involved in all aspects of the research project. It focused on issues of concern to them. It brought forward their understanding of diabetes in their community. And it explored the social context in which diabetes was unfolding. This is known as a participatory approach to research, and it can also be found in education. And so the students and I utilized the very same processes as we shifted the balance of power, each of us taking up the role of learner and educator at different times as needed. We leveraged their priority concerns, which were to be competent and socially engaged practitioners upon graduation. We brought forward their unique gifts and talents in the project. And we created opportunities for them to engage as agents of social change in their role as nursing students. Throughout the course of 5 days of diabetes education workshops and screening to determine the risk of diabetes and cardiovascular disease, all of us were involved in all of the activities. Students, youth, health promoters, women from the women's group. Together, we worked sharing knowledge, ideas. For example, community members learned how to take blood sugar testing. They also began to understand more deeply the significance of obesity and its relationship to inadequate insulin production and uptake of insulin at the cellular level. I distinctly remember during one education session when we were working with the high school youth, examining the amounts of sugar in soft drink beverages produced by transnational corporations, which are now ubiquitous to daily life. And one of the students exclaimed, "I get it. They killed my grandparents with guns during the Civil War, and now they're killing us with pop. But it's the same thing. We're dying, and they're profiting." Together, the students created a mural on one of the walls of the women's store, asserting that health is a human right, and it is the focus of collective struggle today. Of the 100 people that participated in the screening, 30 were found to have diabetes, and an additional 4 had prediabetes. This news was devastating to some, and it was very sobering to the community as a whole. However, the story does not end here. Over the next 4 months, certified diabetes educators from our local area worked with the students, me, and the cooperative of Nuevo Horizonte to promote health promoter training, leading to the creation of 6 workshops that stressed shared leadership, peer support, a more healthy diet based on local ingredients, stress management, education, and medications as needed. These workshops were then facilitated in the community. A group of people coming together during the workshops began a walking group, calling themselves Equipo Azúcar, or Team Sugar. Of the 20 people that participated in at least one workshop, evaluation found that there had been statistically significant reductions in weight, body mass index, waist circumference, and systolic blood pressure. Together, they had collectively lost a total of 46 kilograms and on average reduced their waist circumference by 2 centimeters. This is no easy feat, as many of us know. Today, the Cooperative of Nuevo Horizonte is continuing their efforts to prevent and to manage diabetes. They're coming together to share the responsibility of buying medications, including insulin and syringes as needed, to use one glucometer for blood sugar testing that is located in one of the members' homes, which strategically rotates periodically. They're coming together to develop program proposals for international funding for material and further program support. They're going to be offering a diabetes and cardiovascular risk screening at a village nearby at their request. And in the long term, they envision opening a community-based center for the prevention and management of diabetes for all who are interested. However, the importance of this work and the significance of the efforts of the people of Nuevo Horizonte to take ownership of diabetes as a community health priority are really best captured in the words of Arnulfo Figueroa. He's a young high school teacher from the community who has worked tirelessly with us throughout the entire process.
Screening diabetes in Nuevo Horizonte. It was a very interesting experience to be part of this research project in collaboration with the nursing program at College, students from the popular school and the community of Nuevo Horizonte. Before this research, I didn't know that in Nuevo Horizonte there are many people with diabetes, and after doing the research, I have been more careful with my eating habits. As well, now that I have general knowledge about diabetes, I am able to recommend to my family, students, and the community what kind of food is healthy for them. However, I know that it is also very important to do exercise every day in order to have a balance between daily life activities. I do worry because my aunt has diabetes and my mom is at risk of acquiring diabetes. But at the same time, it is an advantage to know that there are different ways of how to control the diabetes. It is possible to continue living during many years if we do what we have to do, like eating healthy and doing exercise. In the name of Nuevo Horizonte, I want to say thank you very much to the students and professors of the nursing program at College. This research showed us that even with diabetes, it is possible to continue our life for many years, and that the best practice to reduce diabetes is sharing our knowledge with people around the world.
A participatory approach to policy, practice, education, and research is not a panacea for addressing the stark social disparities that disproportionately predispose people who are poor to develop chronic diseases such as diabetes. However, as a nurse and a nursing educator, I do believe it is crucial to capturing the narrative of our patients' lived experience with illness and their capacities to heal. I equally believe it is crucial to creating learning environments where students can translate theory into action, leverage their own unique skills and talents, and really honor the voice of their patients and their expertise. However, its value is truly known by the students when they graduate and enter into the field of nursing. And so the final voice in this TEDx presentation is that of Braden McLeod, one of the nursing students that was involved in the diabetes research project at the Cooperative of Nuevo Horizonte, who graduated early this spring with a baccalaureate degree in nursing from the University of Victoria at Selkirk College.
Nursing education is full of new experiences. We are exposed to and trusted with a specialized toolkit of skills that most of our non-nursing counterparts may only read about somewhere in the depths of Wikipedia or perhaps watch on TV medical dramas. Subcutaneous and intramuscular injections, CPR, and the holy grail of nursing school, IVs. We want to master it all. Being involved in a community-centered research project gave me an opportunity to change my view of the skills that will increasingly be required to be a nurse and shift our profession's role from an agent of the system to an agent of the people. Questioning taken for granted assumptions, partnering with clients and viewing them as the experts of their own experience, recognizing and interpreting patterns and adapting to changing environments beyond our immediate control are all skills that I evaluate as being differently important, not less or more than those that initially made me excited to be a nurse. This experience made me want to pursue further education, but also allowed me to recognize that every nurse, not just those who choose to return to graduate school, will benefit from a mindset of constant inquiry. Almost a year into my career, and I have encountered many nurses who have stopped questioning, have stopped asking why, and to accept the status quo as the only way to proceed. I believe that an immense amount of potential is wasted if our profession only focuses on the small-scale tasks. We need to work to generate knowledge that can be used on the large scale, and nurses will be able to do this with a sense of inquiry founded on an understanding of and appreciation for the research process.
Thank you very much.